Good morning. Today we are going to talk about anatomy of spleen. In this session, we are going to talk about general features of spleen, its borders and surfaces. We'll also talk about development and ligaments of spleen, vasculature of spleen, its innervation and applied anatomy. Some MCQs at the end of this session are for revision and assessment of lecture. Spleen is the largest lymphoid organ of our body. Rather, it is a hemolymphoid organ. It is well-shaped and reddish-brown in color. It lies in the left hypochondrium, just beneath the left dome of diaphragm. The functions of spleen change with age. In fetus, it performs the function of hematopoiesis. In adults, it filters blood by removing worn out and damaged RBCs and microbial agents from the circulation. It provides resistance to body by producing immunoglobulin M, IgM. It acts as a reservoir of blood for it stores RBCs and releases them in circulation when needed. It stores about 1% of the total blood volume. How to remember measurements of spleen? Here is dictum of odd numbers. 1, 3, 5, 7, 9, and 11 can be used to remember the features of spleen. It is 1 inch thick, 3 inches broad, 5 inches long, 7 ounces in weight. 1 ounce is equal to 28.34 grams. It is related to 9th to 11th rib. Its long axis passes along the long axis of 10th rib. External features of spleen. Spleen has two ends. Posterior end of spleen is also called medial end of spleen. Anterior end of the spleen is more like a border. It is called lateral end or anterior border of spleen. Superior border of spleen is notched. Notches represent fusion of spleneculi during the fifth week of intrauterine life. Inferior border of the spleen separates visceral surface of spleen from diaphragmatic surface of spleen. This border is differentiated from superior border because it is not notched. Intermediate border of the spleen separates gastric impression from renal impression. It is present between the superior and inferior borders of spleen on visceral surface. Hilum of the spleen is present on the visceral surface of spleen. It is here where structures either enter or leave spleen. The structures which enter the spleen at hilum are splenic artery and its terminal branches, sympathetic nerve fibers. Structures which leave at the hilum are splenic vein and lymphaticus. Spleen has two surfaces. Diaphragmatic surface, which is smooth, it is related to left dome of diaphragm. Visceral surface is irregular. Visceral surface is irregular. It is related to varus viscera. The hilum of the spleen is present on the visceral surface. Visceral surface of the spleen is related to fundus of the stomach, which gives gastric impression. It is also related to upper pole of the left kidney, which gives renal impression below the intermediate border of spleen. Colic impression is produced by splenic flexure of the colon. It is present over the anterior border or lateral end of spleen. Hilum of the spleen is related to tail of the pancreas, which gives pancreatic impression. So, pancreatic impression is produced by tail of the pancreas. Colic impression is produced by splenic flexure of colon. Renal impression is produced by upper pole of the left kidney, and gastric impression is produced by fundus of stomach on the visceral surface of spleen. On surface, we say spleen lies in left hypochondrium. On opening the abdomen, spleen lies between the fundus of stomach and left dome of diaphragm as shown in this figure. Its long axis is related to Its long axis is related to long axis of left 10th rib. So on surface it lies in the left hypochondrium. Its long axis is related to long axis of left 10th rib. On opening the abdomen, it lies between fundus of stomach and left dome of diaphragm. Anterior end of the spleen is expanded or more like a border. It is directed downwards, forwards and reaches mid-axillary line. Posterior end of spleen is called medial end. It is directed upwards, backwards and medially. It rests on upper pole of left kidney. As shown in this figure, upper pole of the spleen is directed upwards, backwards and medially. It rests on the upper pole of the left kidney. Position of the spleen. If we see on the surface, it lies in the left hypochondrium. After opening the abdomen, it lies between the fundus of stomach and diaphragm. Relation with the ribs, it is related to 9th, 10th and 11th rib. It has two ends. Anterior end is expanded or more like a border. It is directed downwards, forwards and reaches the mid-axillary line. It is also called the lateral end of the spleen. Its long axis lies along the long axis of the 10th rib. Posterior end, as shown in this diagram, posterior end is also called the medial end. It is related to the upper pole of the left kidney. If we take an ultrasound of the spleen, its posterior end is related to the left kidney. It has diaphragmatic surface and visceral surface. On the visceral surface is hilum of the spleen, which is related to the pancreas. This hypoechogenic shadow leaving the hilum of the spleen is splenic vein. It drains into portal vein. So spleen has got a medial end, it has got a lateral end reaches mid-axillary line. It has got three borders, superior, inferior, and between the two lies intermediate border. Some authorities consider anterior or lateral end of the spleen as a border. So in that case, there are four borders of the spleen. Superior border is notched. Notches remind us about fetal lobulation. Inferior border is rounded and separates the visceral and the diaphragmatic surfaces of the spleen. Superior border, as already said, is notched. This notching represents the fetal lobulation of spleen. Inferior border separates visceral surface from diaphragmatic surface of spleen. On the visceral surface of the spleen is hilum of the spleen. Between the superior and inferior borders of the spleen on the visceral surface is intermediate border of the spleen. This border divides the visceral surface into superiorly located gastric impression and inferiorly located renal impression. Anterior border, anterior end of the spleen is also called anterior border. It is regarded as a border by some authorities. Inferior border of the spleen is rounded. It separates visceral and diaphragmatic surfaces of the spleen. It is not notched. This is how we differentiate it from the superior border. Intermediate border of the spleen lies between superior and inferior borders. It separates gastric and renal impressions. Intermediate border of the spleen, as shown in this diagram, separates gastric and renal impressions. Spleen has got two surfaces. Visceral surface, which is irregular, it is related to the varus viscera, and diaphragmatic surface, which is smooth, is related to undersurface of left dome of diaphragm. Diaphragmatic surface is convex, smooth. It is related to the undersurface of the diaphragm, postdiaphragmatic recess, lungs and pleura. It is also related to the 9th, 10th and 11th ribs on left side. Visceral surface of the spleen is concave and irregular. It is related to fundus of the stomach, which causes gastric impression, anterior surface of the left kidney, which causes renal impression. Splenic flexure of the colon is related to its anterior border, and it also presents hilum, which is related to the tail of the pancreas. So the impressions are gastric impression, renal impression, then pancreatic impression and colic impression as already described. In this diagram, we can see tail of the pancreas related to the hilum of the spleen, fundus of the stomach, related to the visceral surface of the spleen, colon, splenic flexure of the colon, related to the anterior border of the spleen. In this diagram, we can see superior pole of the kidney related to the medial end of the spleen. In this diagram, we can see superior pole of the left kidney related to the medial end of spleen, splenic flexure of the colon related to the anterior border, pancreas related to hilum of the spleen. Now in this diagram, we see stomach lies anterior to the spleen. If we consider other impressions like renal, pancreatic, and if we remove the stomach, what remains there is gastric impression on the visceral surface of the spleen above the intermediate border. So the various impressions on the visceral surface of the spleen are gastric above the intermediate border, renal impression below the intermediate border, pancreatic impression related to hilum of the spleen, and colic impression caused by splenic fracture of the colon related to the anterior end of or anterior or lateral end of spleen. Spleen has got two angles, anterior and posterior angle. Anterior angle is called anterior basal or clinical angle of the spleen. Clinical angle of spleen, it lies at the junction of superior border with the lateral end. It lies in the ninth intercostal space behind the axillary line. The importance of this angle is that this angle becomes first palpable in case of splenomegaly. That is why it is called clinical angle of the spleen. As shown in this diagram, this angle lies between the superior border and anterior border of the spleen, and this angle becomes first palpable in case of splenomegaly. That is why it is called clinical angle of the spleen. Posterior basal angle of the spleen lies at the junction of inferior border with the lateral or anterior end of the spleen. Now, where from spleen develops? It is mesodermal in origin, develops in the dorsal mesogastrium during the fifth week of intrauterine life. During the fifth week of development, there occur mesodermal condensations in the dorsal mesogastrium. In its left layer, these condensations fuse to form spleen during the fifth week. Notching of the superior border of the spleen represents fetal lobulation. As shown in this diagram, the stomach and posterior to the stomach lies dorsal mesogastrium. In the left layer of the dorsal mesogastrium during the fourth week of intrauterine life, mesodermal condensations appear. These condensations fuse together to form the adult spleen. The superior border of the spleen is notched. This is due to the fusion of these spleniculi. Now, what are ligaments of the spleen? Spleen is connected with the surrounding structures by gastrosplenic ligament, linorenal, linophrenic, and phrenicocholic ligament. As shown in this transverse section of the abdominal cavity, gastrosplenic ligament connects the stomach to the anterior lip of the hilum of the spleen. It contains short gastric arteries, veins, lymphatics, and nerves, as shown in this diagram. So, gastrosplenic ligament lies between the stomach and anterior lip of hilum of the spleen. Linorenal ligament connects anterior surface of left kidney with the posterior lip of the hilum of spleen. It contains tail of the pancreas, splenic vessels, lymphatics, and nerves. This is linorenal ligament. Linophrenic ligament lies between spleen and undersurface of diaphragm. It is also called a suspensory ligament of spleen. So the ligaments are phrenico-splenic ligament, gastrosplenic ligament, linorenal ligament, phrenicocholic ligament. Phrenicocholic ligament is also called a sustentaculum linis. Phrenicocholic fold extends from diaphragm to the colon. This ligament supports spleen from left colic flexure to diaphragm. It prevents spread of infection from left paracolic gutter to supracolic compartment of peritoneal cavity. On the right side, Infections can go from pelvis to the supracholic compartment through right lateral paracholic gutter. On the left side, this spread of infection is prevented by the phrenicocholic ligament from infracholic to supracholic compartment. What is hilum of the spleen? Hilum of the spleen is present on the visceral surface of the spleen, where structures either enter or leave spleen. Now, what are the structures which enter? Structures which enter are splenic artery, and along with it we have sympathetic nerves. Structures leaving are splenic vein and lymphaticus. As shown in this diagram, hilum is present on the visceral surface of the spleen. Splenic artery, after dividing into many branches, enters the hilum. Splenic vein leaves. Sympatheticus follow the branches of the artery, and lymphaticus leave at the hilum. Long axis of the spleen is related to long axis of the 10th rib. Peritoneal relations of spleen. The spleen is totally enclosed in peritoneum, so it is an intraperitoneal organ, with the exception of hilum, which is extraperitoneal, from where two peritoneal folds go, one to the stomach, called as gastrosplenic ligament, and one to the left kidney, named as lienorenal ligament. Spleen is supplied by splenic artery. Splenic artery is the largest branch of the celiac trunk. It is known for its tortuosity. Like other tortuous arteries in the body are facial artery and uterine artery. It traverses via the lienorenal ligament to reach near the hilum of the spleen, where it breaks up into 5 or more branches which enter into the spleen via hilum. So as shown in this diagram, origin of the splenic artery from celiac trunk. It reaches the hilum of the spleen, divides into many branches which supply the spleen. In addition to spleen, this vessel also supplies the stomach through short gastric arteries and left gastroepiploic artery, which is also called left gastroomental artery. In this diagram, we can see splenic artery originating from celiac trunk. So it passes towards the hilum of the spleen. It also supplies the pancreas by giving many branches to body of the pancreas. One of the branches is larger and we call it as arteria pancreatica magna. Then it reaches the hilum where it divides into many branches which supply the spleen. In addition to this, it also supplies the stomach through left gastroepiploic and short gastric arteries. Short gastric arteries supply fundus of the stomach. As shown in this diagram, splenic artery gives left gastroomental and short gastric arteries before it enters the hilum of the spleen. Vascular segments of the spleen. Splenic artery divides into superior and inferior branches. These branches typically don't anastomose, and every branch supplies its own territory or section. So an avascular zone exists between these two segments or sections. Thus, the spleen presents two sections, superior and inferior, divided by an avascular plane passing perpendicular to the long axis of the spleen. The knowledge of these vascular sections is crucial for segmental resection of the spleen to sustain the splenic tissue if damaged. The branches of the splenic artery inside the spleen are segmental in distribution. On the other hand, the distribution of the splenic vein inside the spleens are intersegmental. As shown in this diagram, venous drainage of the spleen. The venous blood from the spleen is drained by splenic vein that is formed at the hilum by union of 5 or more tributaries which come out from the splenic substance. The splenic vein is run a straight course from left to right behind the body of the pancreas. This vein acts as a landmark for identification of the pancreas during sonographic anatomy. In sonographic anatomy, we say pancreas drives over splenic vein. Behind the neck of the pancreas, it joins superior mesenteric vein to form portal vein. Its tributaries are short gastric veins, left gastroepiploic vein, pancreatic veins, and inferior mesenteric vein. As shown in this diagram, so splenic vein begins discourse at the hilum. Its tributaries are short gastric veins, left gastroepiploic veins, inferior mesenteric vein. It joins superior mesenteric vein behind the neck of pancreas to form portal vein. Portal vein enters liver and divides into right and left branches. It can be differentiated from hepatic veins by hyperechogenicity of its walls. The walls are hepatic veins are hypoechogenic on USG scanning. Lymphatic drainage of spleen. The lymph vessels emerge from the hilum and pass through a few nodes along the course of the splenic artery and then drain into celiac nodes, as shown in this diagram. Innervation of the spleen. Spleen is supplied by sympathetic nerves. These nerves originate from T12 and annual segments of the spinal cord. The sympathetic nerve fibers are distributed along the branches of the splenic artery, as shown in this diagram. The nerves accompany branches of splenic artery. They are derived from celiac plexus, which is composed predominantly by sympathetic nerves. The fibers supply blood vessels, smooth muscle, and trabeculae of spleen. They are vasomotor. But now what is splenomegaly? Enlargement of the spleen beyond the normal limits is called splenomegaly. Normally, spleen is not a palpable organ, but when it enlarges 2 to 3 times, it becomes palpable. Enlarged spleen can also be picked up by ultrasound. There we measure pole-to-pole length of the spleen, and up to 13 centimeters, we take it as normal. Beyond 13 centimeters, we say it is splenomegaly on ultrasound. Some causes of splenomegaly are infections like malaria, malignancy like CML, chronic myeloid leukemia, and portal hypertension. Now, how to palpate spleen? Normally, spleen is not palpable. So, if it is palpable below the left costal margin, it means enlarged spleen. Another way of measuring the dimensions of the spleen is using ultrasound. Here we take pole-to-pole length of the spleen. If it is more than 13 centimeters, we say spleen is enlarged. What is splenectomy? Surgical removal of the spleen is called splenectomy. Commonest indication for splenectomy is trauma. During splenectomy, our splenic artery is ligated first, followed by the splenic vein. This decreases bleeding. It also decreases size of spleen, so makes mobilization easier. I want to summarize my lecture as spleen is the largest lymphoid organ. It develops in dorsal mesogastrium during 5th week from mesoderm. We can remember the features of spleen by 1, 3, 5, 7, 9, and 11 are used to describe its features. Spleen has two ends, two surfaces, three borders, and four ligaments. It is supplied by splenic artery, drained by splenic vein, and innervated by sympathetic nerves from L1 to T12. Now let us go for a quiz based on this lecture. Spleen is innervated by which of the following plexus? Cervical, brachial, celiac, lumbar. C is correct option. As shown in this diagram, celiac plexus is formed by the sympathetic fibers which originate from T12 and L1 segments of the spinal cord. These sympathetic fibers pass along the splenic artery and are distributed to the spleen through its branches, which enter at the hilum. They are vasomotor. The anterior limit of the normal spleen is represented by which line? Mid-clavicular, anterior axillary, posterior axillary, mid-axillary. Mid-axillary is the correct option. The anterior end of the spleen is more like a border. It is directed downwards, forwards, and reaches mid-axillary line. It is also called lateral end of the spleen. Its long axis lies along the long axis of the 10th rib. As shown in this diagram, so anterior end of the spleen is related to the mid-axillary line. Anterior end of the spleen reaches the mid-axillary line. The long axis of the spleen is related to the long axis of 10th rib. Which of the following structures lies anterior to spleen? Stomach, left lung, left kidney, diaphragm. Stomach is the correct option. As shown in this diagram, if we go to the relations of the spleen, fundus of the stomach lies anteriorly. Other structures lie posterior to the fundus of the stomach. The other structures related to the spleen on the visceral surface are kidney, pancreas, and colic impression. If we remove the fundus, we see their gastric impression above the intermediate border of the spleen on its visceral surface. Which is the embryonic origin of spleen? Foregut, ectoderm, hindgut, midgut. Spleen develops in dorsal mesogastrium. So embryonic origin is foregut. So in this diagram, you can see in the stomach in mesogastrium. Posterior to it is the dorsal mesogastrium. Spleniculi develop in the dorsal mesogastrium during 4th week of intrauterine life. During the 5th week, they fuse to form spleen. It is superior border present spleniculi, which represents its fetal origin. It is connected with the stomach by gastrosplenic ligament and with the kidney by lienorenal ligament. During splenectomy, which structure should be ligated first? Splenic artery, splenic vein, both together, splenic plexus of the nerve. Splenic artery should be ligated first because it will decrease the hemorrhage. It will also decrease the size of the spleen and it makes mobilization easy. As shown in this diagram, splenic artery is to be ligated first, followed by ligation of the splenic vein. The advantages of this procedure are it decreases bleeding, it makes mobilization of the spleen easier, size of the fragile spleen also decreases. Thank you for watching this video. Don't forget to like, subscribe and share my channel. Press on the bell icon to remain